I'm pleased to be joined today on Health Beat by Dr. Jason Bailey, a podiatrist specializing in foot and ankle surgery with Faith Regional Physician Services Orthopedics in Norfolk. And we're talking about Charcot Arthropathy. And doctor, define this condition for us if you would and explain how you treat it.
I'd be pleased to, Rob. Thanks for having me here today. So Charcot Arthropathy is a progressive, basically collapse of the foot and the architecture of the foot. Okay. Most commonly seen in diabetic patients. What we see is patients that are neuropathic or have lost sensation in their feet. Some sort of an injury or trauma, and sometimes not even a trauma, will cause this extreme inflammation to attack the joints of the foot and the bones of the foot, leading to a progressive collapse of the foot. Now, I brought here with me a foot model, and we've got an x-ray up here on the wall to kind of show what happens in this disorder. Mm-hmm. So the joints most commonly affected are what we call the midfoot joints here in the foot. And as we can see behind us in this x-ray, we have complete collapse of the midfoot, which causes what we call a rocker bottom deformity. Now, this rocker bottom deformity creates a lot of pressure underneath the bottom of the foot. Now, when we look at our own feet, normally we have a fairly good arch, and that gives our foot a spring-like effect when we walk. Patients with Charcot, this collapse of the bone creates this large deformity and what we call plantar pressure that most commonly results in ulcer formation or sores to start forming on the foot.
I see.
When these sores form, this puts these patients at a high risk for infection. Many times infection bad enough that it gets into the bone, and then we're talking about extreme limb salvage or amputation to help that patient go on in life and not have further complications. Yeah. Surgically, we can fix this problem with what we call arthrodesis or fusion of the midfoot, the hindfoot, and also the ankle. This x-ray up here specifically is what we call an ankle and hindfoot fusion. We have fixed the ankle joint with what we call an intramedullary nail that goes through the heel and up into the tibia, or the big bone in the leg. And we have also fixed the hindfoot with a plate and some screws. Now, if you look at this foot here, you've noticed that the arch is now reestablished.
Yes.
And there is no further what we call rocker bottom deformity or collapse that would cause this patient to develop an ulceration. This is key that we find these patients early in the disease and that we get them off their feet to prevent these deformities from happening, but to also prevent these infections from setting in.
Well, that is great information, and I appreciate you bringing those slides and the ankle over today. Thank you so much.
You're welcome. Thank you.
That's Health Beat, brought to you by Faith Regional Physician Services.